My name is Jennifer Hata, and I'm a physical therapist at San Joaquin Valley Rehabilitation Hospital, talking today a little bit about stroke. Stroke is also known as a cerebral vascular accident, sometimes commonly known as a CVA, and there are two types, ischemic and hemorrhagic. So the difference between the two are that the ischemic is more of a blockage, so that's where you're getting lack of blood flow to the brain, and then the hemorrhagic is more of like a rupture or a bleeding of the blood vessel, so you have more bleeding in the brain, both causing damage to the brain because there's lack of blood flow and oxygen that's needed to keep the brain working properly. So some of the risk factors for having a stroke are blood pressure, high blood pressure, diabetes, cholesterol, obesity, smoking, and AFib, also known as arterial fibrillation. And sometimes also if you've had a previous stroke, you're at a higher risk for having another stroke. Some of the symptoms, and there are so many, it's a broad spectrum, but they range anywhere from losing your ability to speak and swallow your food, all the way to moving your arm and your leg, usually on one side or the other, left or right. Sometimes though it can occur on both sides, but usually it's one side or the other. And some of the big things are the FAST, F-A-S-T, so that facial droop you'll see, the arm weakness that we talked about, difficulty speaking, and then definitely the T is time to call for help, 911, to get you to the hospital. So here at San Joaquin Valley Rehabilitation Hospital, we do work as an integrative whole. So we have a team of skilled physical therapists, occupational therapists, and speech therapists to address all the needs of the patient. We really try to look at the patient as a whole person and not just their impairments. So we don't look at patients just, oh, this patient can't speak, or this patient can't stand, or this patient can't take a bath. We really try to look at the patient as a whole. So our big rehabilitation motto here at San Joaquin Valley Rehab is to address the symptoms, or making sure that the patient uses their systems, uses their arm, uses their leg as much as they can to regain their function. The only way that you can get better at something that's difficult for you is really trying to work at it. So upstairs and inpatient, and in downstairs and outpatient, if you come for stroke rehabilitation, we really focus on regaining the movement in the arms, legs, even the trunk and the core, so you can sit upright, to be able to speak again, to be able to eat your food and get the right amount of nourishment into your body to really make the progress you need to reach all your goals, because our main goal is to address whatever the patient wants to get better at, whether that's standing, walking, being able to dress themselves again, being able to feed themselves again, working together as a whole team so then that the patient can go home with the least amount of care.